A healthcare worker is safer in a torn country like Afghanistan than they are in South Africa. This emerged at the South African Medical Association's virtual meeting to address safety concerns in the sector. It was sparked by eNCA's exclusive story last week about the assault on a female doctor by a patient at a Soweto clinic. Senior journalist Aviwe Mtila has more.
Obviously, this is quite topical at the moment, especially following what's been circulating recently in the last week of the abuse that some doctors at the Lillian and Ngoyi Healthcare Centre in Soweto took.
The South African Medical Association has held a virtual meeting with the media on the growing issue of doctors being abused at the workplace. This follows eNCA's exclusive interview with the doctor moments after being assaulted at the Lillian Ngoyi Community Clinic.
He stormed, he kicked the box. The sound, it sounded like it was a gunshot. I was scared. I didn't want to be here anymore. I don't want to work under these conditions anymore. When is anyone going to hear me, hear us?
Sama says this abuse of health workers is on the rise in South Africa.
We have seen more than 2 million crime happen 2018-2019. That was the serious crime, 2 million, and including our public sector hospitals and doctors and nurses cases are there.
You must remember that there is no proper training, that is tailor-made for healthcare institutions. These are, the training that is done is just done like you are training for a supermarket or something. But we are dealing with the healthcare institutions, especially with the emergency units, where you find that gangsters have been fighting and now they come to fight within the hospital.
The Medical Association says it's safer to be a doctor in war-torn countries like Afghanistan than in South Africa, and their requests for help are falling on deaf ears.
From Medical Association, we have been trying our best to cooperate with the Department of Health to move forward, to improve security system, and they haven't done. So what we are thinking now, if Department of Health not serious, we need to take this issue in higher level so that we make sure that doctors, nurses, the patients are protected.
Following the incident of assaults last week, Dr. Kubeka says she went to the police but they didn't want to open a criminal case. Although she hopes things will change for the better, she says she knows nothing will. Aviwe Mtila, Johannesburg.